I began really looking at the gut seriously back in the 1990s when I was asked to join a research group at the University of Newcastle that at the time were researching initially chronic fatigue syndrome. And we were doing studies looking, it was one of the first groups in the world at that time, looking at patterns of gut microbes, what was growing in the gut. We were looking at urinary amino acids. We were looking at red blood cell fatty acids and analysing all of those to see what the patterns were. So again, most people don't realise, according to which figures you look at, between 70 and 80% of our entire immune system lines the gut. So that's why the arm of the immune system that is in the blood is the second arm of our immune system, not the first. The first arm of our immune system, the first part of the immune system that needs to be activated, that needs to work, is the part of the immune system that lines the respiratory tract and the gut. The baby is being seeded with the mother's gut bacteria before the baby's born.
So the mother's gut bacteria is compromised and it affects.
Exactly. And that's why we're seeing generational effects getting worse and worse. We're seeing bubs born sicker and sicker because the mums are getting sicker and sicker. But mums have got wrong gut bacteria. In many cases, they've also got a hidden infection happening in the uterus. That's a whole separate story and what the symptoms are for that. With any intervention, I ask 3 questions, and I try to teach my people to ask 3 questions. Is it necessary? Is it safe? Is it effective? For any intervention, whether we're talking about taking paracetamol for a headache, and I would say don't ever take paracetamol for anything. It's not safe. Whether it's effective is irrelevant. Is it necessary? In most cases, it's not. The body only has a limited number of ways it can respond to stressors. So it'll kind of come down to a common pathway, if you like. And so if there's too much by way of toxicity, too much by way of inflammation, too much by way of oxidative stress, it'll impair mitochondrial function. And once the mitochondrial function is impaired, the body can't make enough ATP, enough energy to be able to run all the rest of its processes. So we get increased inflammation, we get increased oxidative stress, we get failure of tissue repair, and so on and so on. Look, there's an old saying that we don't change until the pain of change is less than the pain of staying the same.
Yeah.
So you really can't do anything to help anyone until they have reached the stage where they are sick of where they're at. Once they're at the stage that they're sick of where they're at, then you can start to work with them to bring that change. But they have to get to that point.